Hello, resplendents. Good day. I will discuss about intravenous fluid checklist. I believe this checklist was already discussed to you during your fundamentals of nursing, and you already performed most of the procedures in IV checklist through video recording. This checklist will just be a review for you, and IVF. We believe that IVF is very common in your duty in the hospital. Yet, this is very important for you to master, especially the computations in IV and drug calculations. In this checklist, I added dosage calculation, but before demonstrating the checklist, I will review you of the dosage and calculations. What is intravenous fluids? It is also known as intravenous solutions. They are supplemental fluids used in intravenous therapy to restore or maintain normal fluid volume and electrolyte balance when the oral route is not possible. And IVF fluid therapy is an efficient and effective way of supplying fluids directly into the intravascular fluid compartment and replacing electrolyte losses, and administering medications and blood products. What are the aims or the purpose of IV administration? Number one, it avoids dehydration. Number two, it maintains an effective circulating volume. Number three, it prevents inadequate tissue perfusion during a period when the patient is unable to achieve these goals through normal oral fluid intake. So, meaning IV fluid could cause hydration in case there are dehydration. What are the types of intravenous fluid regulations? Actually, there are two ways to regulate the amount and rate of fluids given during intravenous therapy. It could be manually or using an electric pump. Both methods require the nurse to check your IV regularly to be sure you're getting the correct amount of fluid. Manual regulation is the nurse increases or decreases the pressure that a clamp puts on an intravenous tube to either slow or speed the rate of flow. That's the thing that we do manually during our checklist. They can count the number of drops per minute to make sure that the rate of flow is correct and is adjust it as needed. And then we have electric pump. The rate of flow in your IV can also be modulated with an electric pump. The nurse programs the pump to deliver the desired amount of fluid into the IV at the correct rate. So this is the infusion pump. In MAMC or AMCM, they use infusion pump, especially in pedia, because they need to infuse the exact amount of IV or even medications in pedia. That's why they use an infusion pump. Let's now review the intravenous fluid calculations. So, in getting the flow rate, we use drops per minute for macro set or macro drop, macro drip, or micro drops per minute in micro set or micro drip. So, I will just make the formula easier to remember. We have the volume in cc or ml times drop factor divided by the hours to consume times 60. The cc is 1 cc is equivalent to 1 ml. So you can use either cc or ml. And the drop factor is the if it's macro or micro. So, consider the drop factor. If micro, you will use 60. And macro, you will use 15 or 20 drops per minute. Or it depends on the institution or the hospital. So, hours to consume is the number of hours you will consume. It could be 8 hours, 5 hours, and times 60 is constant. Okay? So how will you know if it's micro or macro with the drip chamber? So macro set, that's the example. So there is no needle in the drip chamber. However, in micro set, there is a needle in the drip chamber. Can you see the circle, the red circle? That's the needle. So in Soluset, usually it's micro set. So let's answer the example. So the doctor ordered 1000 cc or 1000 ml of D5 water to run for 8 hours. Compute the flow rate. So the drop factor is 15. As I said a while ago, the drop factor depends on the affiliating hospital. So if 15, it's macro set. So this is the formula. Just substitute the problem to the formula. So the given numbers. So 1000 cc times 15, which is the drop factor, divided by 8 times 60, hours to consume times 60. So 1000 times 15, 15,000 divided by 480, the answer is 31.25 or 31 to 32 drops per minute. So, meaning you have to count the drops in your IV drip or in your IV 31 to 32 drops per minute. So, shortcut is you divide the 1 full minute into 4. So, it's 15 seconds. So, in 15 seconds, how many drops? Divide 32 into 4. So, the answer is 32 divided by 8 is, 32 divided by 4 is 8. So, in 15 seconds, you will count 8 drops. And you have to double check it. Count it again in 1 full minute. Okay, next. Same problem but different drop factor. For example, the drop factor given is 20. So, this is the formula. You have to substitute 1000 cc, the volume, times 20, drop factor. 8 is the hours to consume times 60. So, 20,000 divided by 480, the answer is 41.67 or 41 to 42 drops per minute. So, it's different, 15 and 20 drop factors. Next is microdrip. The doctor ordered 500 cc of D5 water to run for 8 hours. Compute the flow rate. So, this is the formula, same formula. But the drop factor is 60 for microdrip. So, 500 cc times 60 divided by 8, which is hours to consume, times 60. So, since 60, the drop factor, and the 60 constant is the same, so we can cancel it and go straight to 500 divided by 8. So, the answer is 62.5 or 63 microdrops per minute. So, you have to count in 1 full minute 63 microdrops, or you can divide it by 4 for 15 seconds counting. How about for volume per hour or cc per hour or ml per hour? What is the formula? So, volume in cc or in ml divided by hours to consume. So, example, the doctor ordered 1000 cc of D5 water to run for 8 hours. Compute the volume per hour. So, how many cc per hour or ml per hour? So, 1000 divided by 8 hours, the answer is 125 cc per hour or ml per hour. What do you mean by that? So, the patient should consume 125 cc or ml per hour in 1 hour. So, you can use this before. You have to solve this before calibrating the bottle. Later in the checklist, it will be discussed. So, every hour, 125 until the solution in the bottle is consumed. How about the duration in hours? So, volume in cc divided by the volume per hour. So, for example, D5LR 500cc is about to be consumed, and then you vote. Number 3, D5LR 500cc at 1:30 p.m. With a rate of 56cc per hour, what is the approximate time IVF number 3 will be consumed? So 500cc, the volume, divided by the volume per hour, which is 56cc per hour. So the answer is 8.9 or 9 hours. So IVF number 3 will be consumed at 10:30. Why? Because you started it at 1:30. You count 1:30, 2:30, 3:30, 4:30, 5:30, 6:30, 7:30, 8:30, 9:30, 10:30. So 9 hours from 1:30 is 10:30. Now, let's review the methods for calculation in your dosage calculations. So, basic formula for getting the dosage for the drug or medication that you will administer to your patient is D over A times V equals the answer. So, D is the desired dose or the doctor's order. A is the available drug on hand or on-hand dose, the drug dose on the label of the container. And V is the vehicle or the volume. It could be a tablet, capsule, or liquid. And answer is the amount calculated to be given to the client. So example, the doctor ordered antibiotics 0.5 gram IV, BID, or 2 times a day. The available drug is 250 milligram per 3 ml. How many ml should be given? So first, since the doctor's order is in grams, 0.5 grams, you have to convert it first to milligrams so that they have the same unit of measurement to the available drug. So 0.5 gram is equal to 500 milligrams if you will convert it to milligrams. So 500 milligrams divided by 250 milligrams, which is the 500 is the doctor's order, 250 is the available, times 3 ml, the volume or the vehicle. So the answer is 6 ml. So you have to give 6 ml of medication to the patient. Okay, let's start with a checklist. First is the assessment. Counter-check written doctor's order. The type of solution, route of administration, rate of infusion, duration of infusion, physician signature. This is the most reliable source and only legal record of medications patient is to receive. This also ensures patient receives the correct medications. Make an IV label. Assess patient's medical and medication history. Indicates type of appropriate IV solution to be used and patient's need for medication. Assess compatibility of medication with existing IV solution. Medications that are incompatible with IV solutions result in clouding or crystallization of solution in the IV tubing, which could harm the patient. Assess patency of patient's existing IV infusion line. For medication to reach venous circulation effectively, IV line must be patent. Assess IV insertion site for signs of infiltration or phlebitis, like redness, pallor, swelling, and tenderness on palpation. Confirmation of placement of IV needle or catheter and integrity of surrounding tissues ensure that medication is administered safely. Assess patient's history of drug allergies. Effects of medications can develop rapidly after infusion. Be aware of patients at risk. Assess patient's symptoms before initiating medication therapy. It provides information to evaluate the desired effects of medication. Planning. Expected outcomes. Patient experiences no adverse reactions. Medication infuses within desired time frame. Patient's IV site remain intact without signs of swelling or inflammation or symptoms of tenderness at site. And lastly, patient is able to explain medication purposes, action, side effects, and dosage. Implementation. Perform hand hygiene. This reduces transmission of microorganisms. Assemble medication and supplies at bedside. Red and black ball pens, tape, micropore or transpore, IV solution, IV set. In our checklist, we will use Soluset. 2 pieces 3 cc or 5 cc syringe, antiseptic swab or cotton balls soaked in alcohol in covered container, medicine tray, and the medication. Compute for the appropriate flow rate, volume per hour, and the dosage of medication to be given to the patient. This will be given by the assigned clinical instructor. So, the use of mathematical calculation is to obtain correct rate. So, you will use either microdrip or macrodrip depending on the tubing that you will use. Determine how long each solution of IV should run. After calculating the desired volume per hour, mark the strip or tape to indicate the anticipated fluid level at hourly intervals. In short, you will calibrate. It provides even infusion of fluid over prescribed hourly rate. Using a strip or tape provides a visual scale to assess progress of hourly infusion. Example, hook D5IMB 500cc to run for 10 hours. Start infusion at 1 p.m. So, you will compute the volume per hour. 500 divided by 10 is 50. So, you'll have 50 cc per hour. So, we'll start at 1 p.m. It should be at 0 level. And then, at 2 p.m., it should be at 50. At 3 p.m., it should be at 100 level. So, you have to record the time using color coding. So we usually use the color coding of pens in AMCM. So 7 a.m. to 6:59 p.m. they use black, and 7 p.m. to 6:59 a.m. they use red. Next is place the IV label on the solution container with the drops per minute. It provides a pertinent information of the name of the patient, room number, IV solution, flow rate, and signature of the nurse. Verify patient's identity. It improves medication safety. Explain the purpose of the procedure to the patient or significant others. It poses patient education. Remove old IV fluid container from IV pole and quickly remove spike from old solution container, and without touching tip, insert spike into the new container. Hang the solution container on IV pole, check for air in tubings. If bubbles form, you have to remove them. Gravity assists with delivery of fluid into drip chamber. Squeeze the drip chamber gently until it is half full of the IV solution. Reduces risk of air entering into the tubing. Regulate flow rate according to order. So, since 500 to run for 10 hours, you have to count 50 drops in 1 minute. Here, you have to show your CI that you are regulating the correct drops per minute. It can be in 15 seconds or in 1 full minute, so that we will know that you already know how to regulate an IV of the patient. To continue, we'll learn how to incorporate medication into Soluset. So first, you have to make a medication card because it provides a pertinent information of the name of the patient, the room number, the date ordered, medication, dosage and time of administration, attending physician, and signature of the nurse. So the order is ampicillin 125 mg IV every 12 hours. So the time is 8 a.m. to 8 p.m. And the available drug is 125 mg per 2 ml. So what are you going to do? You have to compute first. 125 divided by 125 times 2 is equals to 2. Here, you will see that I will aspirate 2 ml as my diluent for if the medication is in powder form. So you have to aspirate 2 ml of sterile water. And then, you have to put it in the powdered medication, which is ampicillin. And then, you have to roll it, making sure it is now in liquid form. And then, you will aspirate the calculated dosage or ml. How many? 2 ml of ampicillin. So, aspirate prepared right drug with correct dose. Prepares medication for administration. Close the clamp of the main line to determine the desired amount of IVF diluents into the Soluset. Fill desired IVF diluents into Soluset by opening the clamp from the bottle. Usually, we add 30 ml, or it depends on the manufacturer of the medication. But usually, it's 30 ml. Then close the clamp after and check to be sure that the air vent of the Soluset is open. Disinfect rubber injection port of the Soluset. It prevents introduction of microorganisms during needle insertion. Then, incorporate the drug into the Soluset. Then mix gently. Mixing gently mixes medication with solution in Soluset to ensure equal distribution. Again, make sure that the clamp of the airway is open at the Soluset and regulate the flow rate as ordered or per manufacturer's instruction. So for optimal therapeutic effect, medication should infuse in prescribed interval. Place IV label on Soluset indicating drug incorporation. So you put medication ongoing. It alerts nurses that medication is being infused. It also prevents other medications from being added in the Soluset. And also, observe patient for any adverse reactions while medication is being infused. Since IV medications act rapidly, so you have to observe them while medication is ongoing. When drug is consumed, add more 20 cc of IV fluid to Soluset for flushing to ensure complete administration of the drug and to ensure that all medications clear the tubing. So you can flush depending on the protocol of the institution or the hospital. If flushing is finished, you close the main line. Then open Soluset and fill the Soluset again with 30 ml. This is the maintaining IV fluid that is for your patient for their primary IV fluids. Then close the airway. Then you have to regulate according to physician's order. So that is what we call OSCAR. Open Soluset, close airway, then you have to regulate. So this time, you have to maintain the patent primary IV fluid, the main IV of the patient without medication. Then you have to remove the label, medication ongoing. What is OSCAR? Open Soluset, close airway, then regulate. This is when there is no medication. Then discard all waste according to hospital policy, especially the needles. You have to prevent accidental needle sticks. Then perform hand hygiene. And last is documentation. So you have to document in the chart of the patient the IV bottle number, the type of solution and flow rate, time, the IVF administered, medication given, and the client's response. So I just want to show you the I and O, or the intake and output in MAMC. So this is the intake and output form. So 7 a.m. to 6:59 p.m. they use black. 7 p.m. to 6:59 a.m. they use red. But here in the form, you have red, the IV number, and start and left. So they do not follow the color coding for the time. Their color is you will write in their column constant red pen. For example, this is in AMCM. So at 6 a.m., the IVF left is 275 cc. Our shift usually is 7 a.m. to 3 p.m. And then IVF change at 10:30 during our shift to D5IMB 500 cc times 45 cc per hour. At the end of the shift, before we close the chart, the IVF flow sheet will show the IVF during knock shift. The left is 275, and the AM or morning shift left is 300 cc, the one you change at 10:30. So how will you chart that? So here you will see 6 a.m. the IV is D5LR 500 times 100 cc per hour. The left is 275 cc. So you will write under the start and left is left L 275, and the amount consumed is 275. And then the IVF was changed at 10:30 to D5IMB, so IV number 2, D5IMB, 500 cc times 45 cc per hour. So since it is just started, you will write started. And then, if at the end of the shift, you will write the amount consumed is 200 during your shift. So, the left in knock that we received is 255 cc. 275 cc plus the 200 during our plus the 200 in the IV bottle number 2. So, is the total consumed is 475 cc for the IV. And then, you will endorse it to PM shift, IV bottle at 2 p.m., IV bottle number 2, D5IMB 500 times 45 cc per hour, AM left. So we'll put L in red, L dash 300. That is the AM left, meaning the PM shift will receive 300 cc of IV during their shift, at the start of their shift. By the way, the fluid is constant. The color is constantly black. So, and the amount depends, and the time depends on the color coding of pens.